I feel this program is well set up to help me succeed in my future practice because of the variety of things you're exposed to. They have loads of specialty tracks here, which I found was very unique and really appealing. One thing I'm particularly interested in is stuff to do with inpatients, and the fact that they have their own family medicine team that does inpatient work as hospitalists was really appealing to me. And that's one of the reasons why I picked IU Methodist.
So I think this program is going to train me extremely well for my future career. It's one of the reasons why I chose this program. I have a lot of interest in family medicine, from women's health to the hospital to the clinic. So I really wanted a program that was a very broad spectrum and that would give me great training in all different fields of family medicine. So the way I think this program does that is they have a really good hospital rotation, a really robust hospital service. And I think the clinic is really great because we have a really diverse patient population with a lot of different pathologies and diseases that we treat and that we see. So I think I'll be I can become a really great clinician and also a really great hospitalist here. And so it keeps all the doors open to me. Also, this program has tracks that you're able to choose. I'm really interested in women's health, so I can choose the OB track. This will let me become more comfortable and competent doing OB deliveries, doing OB procedures, and even doing C-sections if I wanted to do that. We have faculty here that are extremely knowledgeable and that can teach on just any subject, so I feel very comfortable and I feel very confident that I'm going to be trained very well for my future career.
And I think this program, because of its strong inpatient training, will allow me to walk into any clinical setting and provide exceptional care for those patients. I have a strong interest in working in hospitals and applying for hospitalist positions, and the acuity of patients and breadth of pathology that we see at IU Methodist gives me great confidence in my career future.
I feel like this program's really prepared me for my future practice. I've gotten lots of exposure to just overall full scope family medicine, meaning cradle to grave. In particular, I am involved in the women's health track. That means that I get a little bit more exposure on a weekly basis to OB clinic, to high-risk OB clinic. I've catered some of my electives towards being more involved in that community. In addition to pediatrics, ideally I'd like to practice mainly women's health and peds. So I feel like I've gotten a lot of experience in that area to prepare me for whatever walks in the door. In addition, we do a lot of inpatient, and so I feel like I can handle both inpatient or outpatient pretty comfortably.
My goal is to one day return to my home of Trinidad and Tobago. And for those of you who don't know, Trinidad and Tobago is one of the Caribbean islands, so we still consider it a developing country. Over here, we see a lot of people from different populations, medically underserved, see a lot of diabetes and high blood pressure, which is some of the bread and butter I see going back home to Trinidad and Tobago. And because we see this medically underserved community, it kind of symbolizes or resembles the kind of population you will see back in Trinidad, of more like as a rural kind of nature. In addition to that, we also have a lot of different tracks here. And one of the tracks that I was also a part of is the global health track, which allowed me the opportunity to go back to Trinidad and Tobago and actually be immersed in the medical system there for a month to kind of get a good idea of how it works compared to the US system. And I felt that was very beneficial for me, as let me know and kind of solidify that my medical knowledge was actually on par with where I should be, and that it's going to be helpful to go back and serve my community back home in Trinidad. So overall, I feel like this program really prepares us for the world out there, given the diversity of pathology we see, the different tracks it has on offer, the guidance for clinical staff and faculty, and the cohesiveness of our residents here, who really help each other out and make sure that we understand everything going forward.